Hello, my name is Irene Goyes. That's Gollac. And this week in Adult Health 2, Module 1, we were asked to build some lungs. I had some technical difficulties, so my chest cavity is a little bit on the smaller side, but we'll get into chest capacity later. So we were asked to build this and then answer a few questions. So question one talks about to describe what's happening when we inhale. So so they kind of work. I don't know, maybe if you could see it from this angle, or if there's a glare. See, it works. Just a little bit. My person's probably a smoker. Anyhow, so when this is the diaphragm, by the way, the balloons represent a lung, and this is my bronchi. So when um, we take a deep breath in, our diaphragm pushes downward, and you can feel it when you breathe in, right? When you inhale, your ribs are going up, the balloons or our lungs, they fill up with air. And then when we exhale, which is question number two, the balloons or our lungs deflate. And so our diaphragm goes back up, our ribs go back down, and we exhale. And it's kind of like at a relaxed state, I guess you could say. Um, so yeah. So that's question one and two. And then talking about larger and smaller lung capacity. So taller people tend to have larger chests, so therefore they have bigger chest capacity. Um, Location, high altitudes can create for larger capacities as well to help them compensate for the lower atmospheric pressure. Lifestyle, for example, obese and smokers tend to have a lower capacity but higher rates of ventilation. And that's probably because their body's trying to compensate and make sure the body gets all the oxygen that it needs to do its job. So that is my lungs. Had a little issue with the balloon here fitting the bottom, but they do still somewhat inflate. I don't know if you can see it at that angle. But anyhow, so this is the diaphragm going down, pushing down on the stomach and everything, and then the ribs go up, um, and we get air into our lungs. Question number four, describe how does asthma affect the lungs? Um, Asthma. Okay, sorry, lost my train of thought there for a moment. So asthma affects the lungs. So this again is our bronchi. This is how the air goes from, the outside to and from into the lungs here, right? So what happens with asthma is that the bronchi or the airway gets constricted, so it's tightened. So you can imagine it becomes harder to breathe, right? So what are we going to do for that? Well, we're going to use bronchodilators, and that will help open up the airway. So instead of being constricted, it's going to open it up a little bit and make it easier for our patients to breathe and be able to get air more effectively and to the rest of the body there. And then, um, so bronchodilators, steroids would be a choice of medication. As you know, bronchodilator, the most popular one is albuterol. That's more of like a rescue inhaler. So lots of patient education there to let the patient know that's just a rescue inhaler and how to use the inhaler. Um, Interventions, priorities would obviously be, our ABCs, airway, breathing, circulation. So with an asthma attack, all three of those are actually affected. So we want to make sure we have a nice patent airway. And like I said, we can do like a nebulizer treatment that would probably help oxygen to supplement for the oxygen that the patient's not able to get right away. that will help control the breathing. Now with the albuterol or other bronchodilators, it can also cause the heart to palpate or get a little tachypnea, beats fast. Um, and then a steroid, usually prednisone, is the drug of choice there. And then, patient might be having some anxiety. They can't breathe like they normally do, right? So that might cause a person um, to also exacerbate their asthma. So we want to make sure we keep them nice and calm. Okay. Um, let's see. Question number 6. What would be important to teach the patient with asthma? I think I kind of just went over that as far as, the inhalers, how to use the inhaler, the rescue inhalers to be only used as a rescue inhaler. Um, if their asthma is really bad, they might be prescribed a longer acting bronchodilator, in which that would need to be taught to them as well when to use that. Prescriptions can be, every 4 hours or BID or whatnot. So depending on how that's ordered, we would have to teach them how to do that. Also, when to come in, the signs and symptoms of an asthma attack. And they might want to keep a pulse oximeter on hand as well. Finally, what community resources are available to clients with asthma? Well, here in Maricopa County, they have an asthma coalition program, and I thought it was really, really cool. In the elementary schools, I believe it was just the elementary schools, they have a flag that they raise at the school to let their parents and, of course, the kids know what the air climate is for that day. So that helps them better prepare for the day for their child or the student themselves. So I thought that was really nice. And of course, they offer fairs around the community to use, to give patient education and whatnot. So really cool resource here in Maricopa County. Well, that is the end of my video. I hope you found it helpful, and that's it. Bye.